Good evening, everybody. Today we will be discussing about the obesity and diabetes, addressing the epidemic. So, obesity and diabetes are two most of the pressing health challenges facing the world today. Obesity is a condition characterized by excessive body fat accumulation and that adversely affect the health. And diabetes is a chronic condition that affects how your body regulates the blood sugar. So both conditions are on raise and they can lead to a number of health complications together. So let's talk about the obesity bit. So the global burden of obesity is staggering. According to the World Health Organization, that is WHO, in 2016, over 1.9 billion adults aged 18 years and older were overweight, which is over 650 million were obese. So these numbers have continued to rise in recent years, and the prevalence of overweight and obese is on rise globally, and it is a major public health concern right now. Coming to the diabetes, so diabetes is also another major health concern. In 2019, it is estimated that 463 million adults were living in the diabetes worldwide. So number of people with diabetes has nearly quadrupled since 1980. This is dramatically increased due to the number of factors, including population, aging, urbanization, and lifestyle changes. Now coming to the rising cost of obesity and diabetes. Now obesity and diabetes are not only public health crisis, but also financial burden also. So the annual health cost of the adult with diagnosed diabetes is significantly higher than cost of other adults without diabetes. So it is impacting economically also that obese and diabetes are substantial, placing the strain on healthcare system around the world. Now coming to the risk factor of obesity. So there are unhealthy diets, physical inactivity, genetics, and socio-economical factors. Now in unhealthy diet, consuming too many of calories and unhealthy fat, sugary drinks, processed food can increase your risk of obesity. Then lack of physical activity can lead to weight gain and obesity. In genetics, people more genetically predisposed to the obesity than others. So people with lower social economic status are more likely to be obese. Now coming to the risk factor of type 2 diabetes. So obesity is a major risk factor for type 2 diabetes. When you are obese, your body fat cell become resistant to the insulin. This is what happens in type 2 diabetes, which can lead to the high blood sugar levels. So patient who has family history of diabetes are more likely to have this kind of type 2 diabetes. Having parent, sibling or child with diabetes increase your risk of developing this condition. Then the risk of type 2 diabetes increase with the age. So also there are certain races and ethnicities that are higher risk of type 2 diabetes like Hispanic, Latino, Black, Asian, American and Pacific Islanders. Now there is one more condition which we should not take lightly, is a pre-diabetic condition in which blood sugar levels are higher than the normal but not high enough to be diagnosed as a type 2 diabetes. Having pre-diabetes increase your risk of developing type 2 diabetes and the heart diseases and stroke. But the good news is that pre-diabetes can often be reversed or delayed with the lifestyle changes such as healthy eating and physical activity. Now coming to the complications of obesity and diabetes. So heart diseases, stroke, kidney diseases, eye problem and nerve damages are major complications of diabetes and obesity. So for heart, diabetes and obesity are major risk factor for heart diseases and leading cause of death worldwide. Also in stroke condition, it increases your risk of the stroke, and it is a third leading cause of death in worldwide. So, and kidney diseases also, it damages kidney, leading to the kidney disease and eventually lead to the kidney failure. In eye problems, diabetes can lead to the eye problems such as diabetic retinopathy, which can also cause blindness. Then diabetes can damage our nerve, leading to the pain, numbness, and tingling sensation in the hands and feet. Now we know diabetes and obesity is harmful. So how to prevent it? So there are four major factors that we can prevent or control these two things. So a healthy diet, physical activity, maintaining healthy weight, and getting regular checkups. So eating healthy diet is essential to prevent both diabetes and obesity also. So what we should do is we should focus on consuming plenty of fruits, vegetable, whole grains, limit our intake of processed sugar, foods, and unhealthy fats. Then physical activity, we should do at least 30 minutes of moderate to intense workout for most of the days of the week, like 3 to 4 days, we should do the workout. So maintaining healthy weight, if you are overweight or obese, losing even small amount of weight can significantly improve our health and reduce the chances of developing diabetes. So we should maintain our healthy weight. Getting regular checkup is another most important factor. To see your doctor and regular checkup to monitor our blood sugar levels and screen for diabetes is also one of the major factors. As we discussed the pre-diabetic condition, we can stop the disease at the pre-diabetic stage only. Now, even though all of this we have diabetes, then how to live with it? So if you have diabetes, there are number of things which we can do to manage the condition or live life healthy. So four of them are mainly blood sugar monitoring, meal planning, exercising, and medication. Now, in blood sugar monitoring, regular monitoring your blood sugar levels is essential for managing diabetes. This will help us to track our progress and make the adjustment of our diet, exercise, and medication as we need it. So planning our meal will be the another important factor, because eating healthy meals and snacks will lower our sugar and fat, which is important for managing diabetes. So what we should do, we should go to the registered dietitian and help us to create the meals that meet our individual goals. So exercise, as we discussed, it's important. It will help us to regulate lower the blood sugar levels and improve the insulin sensitivity. Now, medication. Some people with diabetes need to take medication to help them or control their blood sugar levels. So there are different types of diabetic medication available, and if your doctor will work with you with the best outcome we can get. Now, healthy coping mechanism. So living with the diabetes can be stressful. So it's important to find healthy coping mechanism to manage stress and improve our overall well-being. Some helpful coping mechanism include exercise, relaxation technique, and social support. Now coming to the public health initiatives, that there are a number of public health initiatives that are aimed to prevent and control the obesity and diabetes. These initiatives focus on promoting health, eating, physical activity, and weight loss. So they also work to address the social determinants of the health, such as poverty and lack of access to the healthy foods and safe places to exercise. Now coming to the conclusion. So obesity and diabetes are serious public health challenges, but they are preventable and manageable. By making healthy lifestyle choices and working with your doctor, you can reduce your risk of developing this disease. If you have already been diagnosed with obesity or diabetes, there are steps that you can take to manage the condition and live healthy lifestyle. Thank you for the patience listening.